Hi, my name is Ami Patrawala, and I'm the Program Director for the Pulmonary and Critical Care Medicine Fellowship Program at Rutgers, New Jersey Medical School. I'm excited to introduce you to our program, which offers an outstanding experience in pulmonary and critical care. As part of Rutgers, the State University of New Jersey, the fellowship program offers many resources and opportunities for our trainees. We offer a 3-year ACGME accredited pulmonary and critical care fellowship as well as 1- or 2-year critical care positions. Currently, we have 13 fellows across 3 sites. 10 are pulmonary critical care and 3 are critical care. Our goals are to deliver high-quality, hands-on clinical training embedded in an extensive educational program, engage learners in scientific inquiry, and develop their skills as educators. We also strive to enhance the individual interests of each fellow and to develop niches as their training progresses. Our overall mission is to train fellows to be outstanding clinicians, educators, and leaders. Fellows in our program rotate to 3 hospitals: the University Hospital, Hackensack University Medical Center, and the East Orange VA Medical Center. Each provides a unique experience to the pulmonary and critical care trainee. Here at University Hospital, we serve both an inner-city, diverse population as well as care for patients referred from around the state for more specialized conditions. UH is really home base for the program, and fellows rotate to the medical ICU, SICU, and on pulmonary consults, becoming comfortable with both straightforward and more complex respiratory and critical care illnesses. Fellows readily learn how to triage, lead rounds, and manage patients independently with lots of mentoring and practice. Our fellows are looked upon as leaders and a valuable resource for residents and students, and they engage with them daily. You will hear more about Hackensack and the VA New Jersey healthcare system from Dr. Sadicott and George. In addition to core rotations in medical intensive care and pulmonary consultation, fellows can tailor their training to include experiences in pulmonary hypertension, tuberculosis and other mycobacterial diseases, and war-related airborne hazards, just to name a few. Our dedicated and highly skilled faculty work closely with each fellow and enjoy the close collegial relationship that develop. In the rest of the video, you will hear from our Division Director, Andy Berman, University Hospital faculty, Jonathan Greenstein and Keith Guevara, Sean Sadicott from Hackensack, and Jason George at the VA New Jersey healthcare system, as well as from a couple of our current fellows, Khalid and Avalon. Please reach out if you have additional questions about our fellowship, and again, thank you for your interest.
Hi, I'm Andy Berman, the Chief of the Division of Pulmonary and Critical Care Medicine. I also oversee the divisions of Allergy and Rheumatology, which creates clinical and research opportunities. I've been at New Jersey Medical School for about 10 years now, and during that time I've had the pleasure to see the hospital, the medical school, and most especially our division grow and thrive. The division now has more faculty and fellows and offers more opportunities in clinical medicine, education, and research than ever before. Our faculty are skilled in the diagnosis and management of complex pulmonary diseases and critical illness and have expertise in subspecialty areas including tuberculosis and non-tuberculous mycobacterial infections, airway diseases, sarcoidosis, sleep apnea, sepsis, and a broad application of point-of-care ultrasound. And these past few months of the pandemic has pushed COVID-19 into this list as well. While certainly amongst the most trying times in modern medicine, NJMS pulmonary and critical care faculty and fellows have shown that teamwork and skill and humanism are what makes this program stand out. Other highlights include the division's leadership in one of 4 CDC-recognized centers of tuberculosis in the United States, and also New Jersey's only designated sarcoidosis center. Many of the faculty also serve as faculty for regional and national ultrasound programs, and each year some of our fellows serve as instructors as well. Our faculties and fellows also have the privilege to teach and train NJMS medical students and residents who are part of most clinical rotations. We place education as one of the core elements of our program, and prior teaching awards attained by faculty and fellows suggest we do this well. Our fellows bring a diverse set of experience to the training that enhance the program, and all go off to launch successful careers after fellowship training, many with faculty appointments. I would say that we are a close-knit division. which makes patient care and clinical investigation stimulating and rewarding experiences. I hope you enjoy your e-visit to the Rutgers, New Jersey Medical School Pulmonary and Critical Care Division. Please reach out to us if you would like additional information.
I am Keith Guevara, Associate Program Director for the Fellowship Program. I practice pulmonary and critical care medicine at University Hospital, the principal teaching hospital for Rutgers, New Jersey Medical School.
And I'm Jonathan Greenstein, Keith's partner in crime. I practice pulmonary, critical care, and sleep medicine at University Hospital.
We have the privilege of working with a great group of fellows year after year, and have fun focusing our efforts specifically on procedural training, simulation, and point-of-care ultrasonography.
I think we have a really special fellowship program that fosters the growth of a wide breadth of clinical skills. In the first 2 months of fellowship, fellows participate in simulation sessions to jumpstart their training. All fellows receive simulation training in endotracheal intubation with a focus on using video laryngoscopy. They work at multiple hospitals where they are the primary intubator in the medical intensive care unit.
To make sure everybody has the building blocks of becoming expert proceduralists, the fellowship program provides central line, thoracentesis, intraosseous access, and bronchoscopy training on high-fidelity mannequins.
That equipment is readily available throughout the year for anybody who wishes to practice and improve their skills.
Point-of-care ultrasonography is a cornerstone of our fellowship program. First-year fellows participate in an initial crash course where they learn all the fundamentals of critical care ultrasonography, and they have longitudinal learning through the fellowship program.
Fellows use ultrasonography on a daily basis on the pulmonary consult service and in the medical intensive care unit. We supplement initial ultrasound training with a bi-weekly ultrasound conference and focused lectures throughout the year. Furthermore, fellows learn to generate formal reports of all ultrasound studies performed, which are uploaded into the EMR along with the captured images. I'm board certified in critical care echocardiography, and Keith is a testimer of the examination currently working towards full board certification.
This advanced echocardiography expertise, which allows us to make complex hemodynamic assessment at the point of care, is regularly taught to the fellows, some of whom are pursuing board certification in critical care echocardiography.
We have both been teaching ultrasonography at CHEST, Keith since 2010, myself since 2012. We really enjoy going out to CHEST headquarters and bringing an enthusiastic and qualified fellow with us to serve as faculty.
We do bread and butter bronchoscopic procedures along with more advanced techniques. Fellows will become adept at linear endobronchial ultrasound, radial EBIS, and electromagnetic navigational bronchoscopy.
In addition to all that, fellows will also learn to master chest tube placement and have the opportunity to learn how to place tunneled indwelling pleural catheters.
I joined the faculty here in 2013, and I've enjoyed being a part of this great program. I truly believe that this program offers a great well-rounded educational and clinical experience. Fellows have the opportunity to care for a wide breadth of diseases, including advanced liver care in the only liver transplant center in northern New Jersey. Graduates are ready to hit the ground running and impress their employers with skills they have learned.
I joined the faculty here in 2017, straight out of my sleep medicine fellowship. It has been incredibly rewarding working with a diverse faculty with many different areas of expertise. I've really enjoyed working with Keith, despite his mustache. I think we've grown an extremely strong ultrasonography program, deliver high-quality critical care, and we are proud to perform most procedures ourselves.
If you like what you've read on the website and are hearing on this video, we hope you will consider applying to our program. It is strong and enthusiastic fellows that make our job so exciting and interesting.
Hi, my name is Avalon. I'm a second-year pulmonary critical care fellow at Rutgers NJMS. Here's what you can expect at Rutgers. First year is very critical care heavy, and we get a variety of pathology in our 3 rotation sites. University Hospital is a liver center and a stroke center, so in addition to our typical MICU patients, we take care of end-stage liver failure patients and critical neuro ICU patients. At Hackensack, we also manage the CCU, so we get experience with advanced heart failure, arrhythmias, and some ECMO patients. It's also a cancer center with many clinical trials, So we take care of end-stage cancer patients with unusual infections and complications of chemo or CAR T-cell therapy. At the VA, we manage the MICU as well as the SICU, so we get experience with post-op complications. This is a very procedure-heavy program. You will become comfortable with all the basic critical care procedures. I'm just starting second year, and because we manage our own airways, I feel comfortable with conscious sedation and intubations, which wasn't offered at all the programs I interviewed at. As I transition into second year, I'm focusing on more in-depth physiology, becoming more adept at intubations and bronchoscopy, and transitioning into co-leading rounds with the attendings. Overall, first year was very challenging, but I feel that the variety of patients and procedural exposure will prepare me well for my career.
My name is Khaled. I'm a third year Chief Fellow. Looking forward to becoming an attending next year. I feel very prepared to walk into any ICU in the country and be confident in my ability to handle anything thrown my way. With our experience at University Hospital, HMC, and the VA, I've gotten the chance to see and take care of very interesting and very complex patients. With the procedure volume and the independence that we have as fellows, I feel ready to manage all of my ICU patients. In terms of pulmonary medicine, with our various sites, I've been exposed to the breadth and depth of pulmonary medicine, from obstructive lung disease to ILD, chest infections, pleural diseases, and malignancy. With a growing advanced procedure volume, I feel ready to use EBUS and navigational bronchoscopy in my future practice. I've also had a lot of sleep medicine exposure, and that's led me to apply to sleep medicine fellowship this upcoming year. The COVID pandemic has been difficult for all of us, mentally, emotionally, and physically, but the one thing that makes it easier is the people that you work with. All the fellows and attendings really coalesced and did an amazing job shouldering the load together.
Hi, my name is Sean Sadicott, and I am the site director here at Hackensack University Medical Center. Hackensack has served as a great complementary site for the Pulmonary and Critical Care Fellowship for years. Hackensack is a large tertiary teaching hospital with over 750 beds and is the largest hospital in the Hackensack Meridian Health Network. I am a big believer in the importance for fellows in training to be exposed to as many types of patients as possible. And fortunately, we're able to help make that possible for the fellowship in several ways. We are fortunate to have an extremely large cancer center, the John Theurer Cancer Center, which allows our fellows to be exposed to patients receiving all novel oncologic therapies such as CAR T and new immunotherapies. Our fellows are able to see both pulmonary complications of these therapies and illnesses and become adept at the management of these patients when they are critically ill. The Heart and Vascular Hospital at Hackensack UMC provides learning opportunities in pulmonary hypertension and the use of multiple support devices, including Impellas, LVADs, and ECMO. Fellows rotating in the Hackensack ICU will be exposed to a wide variety of critically ill patients in our 20-bed mixed ICU. Fellows also have the opportunity to rotate in the cardiothoracic ICU with anesthesia and with the advanced CHF pulmonary hypertension group. Prior to the COVID-19 pandemic, our fellows were exposed to ECMO while rotating in the cardiothoracic ICU. That will likely change moving forward after we manage 27 ECMO cases in our ICU when the pandemic struck our area. While on the pulmonary rotation, fellows participate in a number of procedures, including thoracentesis, routine bronchoscopies, EBUS-guided biopsies, and navigational bronchoscopy. The Division of Pulmonary and Critical Care, led by our director, Dr. Keith Rose, is a rapidly growing division with a growing group of full-time faculty, several who are now graduates of the NJMS Fellowship. We believe rotating at Hackensack is a unique learning experience for the fellows, and I hope to have a chance to speak to you more about the site during your interview.
Hi, my name is Jason George, and I'm a member of the Pulmonary and Critical Care Division at the VA New Jersey Healthcare System. We have an active outpatient program with an average census of 80 visits weekly distributed among 5 clinics. I know many of you have worked at the VA medical centers before at some point in your medical education and can appreciate the value of serving and learning from our veterans. For those of you who have not been in the VA center, I encourage you to recognize this wonderful resource and opportunity to expand your medical knowledge and gain professional satisfaction from helping those who have served. Thank you for your interest in our program.
Rutgers, New Jersey Medical School Pulmonary Critical Care Fellows are a diverse group of individuals who come together with like-minded goals. We are really proud of our graduates and the long-term professional success they have had. Our graduates are confident clinicians, highly skilled educators, and respected leaders, and we focus on supporting that growth throughout their time with us. We believe we are well positioned to support any career goal you may have.